The soothing caress of water, the whiff of chlorine. Me time, back in the pool.
Is this your first swim since... Is it really?
I've been wanting to go swimming for like ages.
Oh, wow. How's it feeling?
It's very well organised. It's actually quite nice with less people. Sort of wish it was like this all the time, but...
So you're not bumping into anyone?
Yeah, exactly.
I would have preferred them to have opened ages ago. I think they could have opened swimming pools before they opened pubs. But there you go.
You're not the only ones who have said that.
If COVID's taught Britain anything, it's that health, physical and mental, is priceless. And the closure of pools and gyms has been tough.
The last 4 months of lockdown, not being able to get in the pool has been quite difficult for me. For me, swimming, outside of my previous competing, going back to after I was injured in Afghanistan where I lost my leg, it was physical rehabilitation, but more importantly, psychological. And even now with my PTSD, going in and thrashing out some time in the pool was the greatest way for me to deal with that. Having it reopen is a godsend.
For those people I've seen that were queuing up this morning at 6:30, I mean, they've really missed it. And these guys, they're not runners or cyclists or gym goers. They like getting in the pool. So not just for their physical well-being, their mental well-being, they've really needed it. And it's nice I've seen a lot of smiles on faces.
Smiles in England and Northern Ireland, but in Wales and Scotland, indoor gyms and pools still aren't open.
Been waiting for this moment for months, practicing from the comfort of my front room.
But running a swimming pool's an expensive business. Only 20% are opening today. Many leisure centres barely break even. As many as 1,300 could close by the end of the year, risking the loss of 58,000 jobs.
Although we're opening a lot of pools today, there are pools but are still shut. So, the message to the government is these are important community assets. We want to get them open, we want to get people healthy, we need support, and that's financial. However that comes forward to make sure that we don't lose these assets as part of your community.
Get the gyms open safely, reduce the impact of coronavirus. To underline that point, Public Health England today emphasised the links between obesity and falling seriously ill with COVID. A new obesity strategy to be revealed this week is likely to include restrictions on advertising unhealthy food. Nursing the nation back to health, one stroke at a time.
Well, earlier I spoke to the Liberal Democrat MP and leadership candidate Lena Moran. She had bariatric surgery in her early 20s to help her lose weight. She's called for responsible reporting of the debate around obesity. I began by asking her if she agreed that Public Health England's case for action on obesity has never been stronger.
I do absolutely agree. And it's really hard, though. That's the problem with this whole thing, is what I've seen from them is, a big advertising campaign of £10 million, but telling people who are already overweight that they're overweight and that they need to lose weight, I'm not convinced is going to solve the problem. And with my own experience of it, actually, I knew I was overweight from a very, very young age, actually. And I'm concerned that the government has created this policy, but without speaking to people who have struggled with this and have overcome it.
How aggressive does the government need to be with, for example, raising taxes on unhealthy food? We know that they're exploring banning junk food ads on TV before 9 and also online. But do they need to go further and hit people in the wallet?
Actually, the area that I would like to see is a subsidy on foods that are better for you. Often when you look at the sort of the weekly shop, if you're in some of the poorest areas of the country and you're a family just trying to make ends meet, especially now with the downturn that we're seeing in the economy with coronavirus, you start looking for how can you feed your family cheapest. And it's often fresh fruit and vegetables, fresh meat, that's really expensive. So I would love to see subsidy on that.
Does a subsidy for healthier foods need to be coupled with an extension of the sugar tax, which figures suggest has worked, the limited aspect that it's available at the moment in terms of a levy on soft drinks?
The issue I've always had with a sugar tax is that it does tend to hit the poorest. And so actually it maybe needs to be both, but I would start with the subsidy before moving to more sin taxes. But the other part of it, Cathy, and in my own experience, actually my own mental health was a big part of this, to decouple mental health the way that we feel in our minds with the way that we feel in our bodies is critical to get right.
I mean, it is hard to believe looking at you now, but you've said that you once weighed nearly 20 stone. Just tell us about the mental health sort of causes, but also the impact of being obese for you on your mental health.
So it started when I was 1, and at that stage, already, even though my mother was following all the health visitor advice, they noticed that I was already putting weight on more than other children. As I progressed through my teenage years, it did start to have an impact on my self-esteem. And as I went to university, I became depressed, partly because of that and other factors as well. And that's when actually the major ballooning for me happened. And then when I finished university, I actually broke my leg so badly I was in a wheelchair for 3 months. And that's when I really hit that biggest low. And I realized that I needed to do something about it. So we'd explored a lot of this with doctors. There was every diet under the sun I had done. I joined a gym when I was 11. I'd been to countless nutritionists. That genetic element was incredibly strong. But when it got to that point, actually what I found was that the thing that helped me the most was a bariatric operation. It's called a sleeve gastrectomy. I had it when I was 24. And at that stage, I lost half my body weight. And that was not a quick fix. That was definitely something that I would only ever say, you do in partnership with doctors and you think about incredibly carefully.
Do you remember your lowest point in terms of how you viewed your weight, how other people viewed your weight? What was the real sort of cruelest blow for you?
The real low point for me was when I'd broken my leg. So I had jumped off a stage. I was in an orchestra and sort of on the way down realized that was not such a good idea given how much I weighed, and broke my leg so badly that I heard it crack. And then as the ambulance men were carrying me into the ambulance, it took several of them and they were sort of huffing and puffing, and I got to the hospital, had the operation. And I remember in that ambulance saying to myself, I have to try and do something about it, and realizing that was that moment.
Layla Moran, thank you very much for joining us.
Thank you, Kathy.